Complex trauma refers to prolonged and repeated exposure to traumatic events, often occurring during childhood or within interpersonal relationships. It involves a series of traumatic experiences that are chronic, interpersonal, and often involve some form of exploitation, abuse, or neglect. Here is a breakdown of complex trauma. 1. Multiple traumatic events. Complex trauma involves experiencing multiple traumatic events over an extended period. These events can include physical, emotional, or sexual abuse, neglect, domestic violence, witnessing violence, or living in unstable or unsafe environments. 2. Developmental impact. Complex trauma occurs during critical periods of development, particularly in childhood. The repeated exposure to traumatic events can disrupt the normal development of a child's brain, emotions, cognitive abilities, and sense of self. It can impair their ability to form healthy relationships, regulate emotions, and cope with stress. 3. Interpersonal nature. Complex trauma typically arises from traumatic experiences within interpersonal relationships, such as abusive or neglectful caregivers, family dysfunction, or intimate partner violence. The trauma is inflicted by individuals who should provide care, protection, and nurturing, leading to a profound betrayal of trust. 4. Cumulative effects. Complex trauma has cumulative effects, meaning that the impact of each traumatic event adds to the overall trauma burden. The accumulation of trauma can intensify its effects and increase the complexity of the individual's response, making it more challenging to recover. 5. Complex symptoms. Complex trauma can give rise to a wide range of symptoms and difficulties across various domains of functioning. These can include emotional dysregulation, dissociation, chronic physical health problems, self-destructive behaviors, difficulties with trust and relationships, distorted self-perception, identity confusion, and disrupted beliefs about the world. 6. Adverse outcomes. Individuals with complex trauma are at an increased risk of developing mental health disorders, such as post-traumatic stress disorder (PTSD), depression, anxiety, borderline personality disorder, substance abuse, and other relational and behavioral issues. They may also struggle with self-esteem, academic or vocational challenges, and face difficulties in forming healthy attachments. 7. Trauma reenactment and revictimization. Individuals who have experienced complex trauma may unconsciously seek out situations or relationships that replicate aspects of their original traumatic experiences. This pattern can lead to reenactment of trauma, revictimization, and perpetuation of cycles of abuse or dysfunction. 8. Treatment and recovery. Recovery from complex trauma requires specialized and comprehensive interventions that address the unique needs and challenges of individuals who have experienced prolonged and repeated trauma. Treatment often involves a combination of